Thank you, Mr. Chairman. Dr. Price, welcome, and thank you for your willingness to serve in this very important capacity. We've got a lot of challenges ahead that we need to take on. As I met with you a couple of weeks ago, one of the issues that's of particular interest to me, which I conveyed to you, is this issue of Indian Health Service. In 2010, there were some systemic problems that were uncovered in South Dakota, and an administrative action plan was set in motion to help remedy many of these findings. Similar issues popped up again throughout South Dakota in 2015, and they continue to this day. And after oversight hearings, it became abundantly clear that time and again there was a lack of follow-through by the agency. My question is, will you commit to follow up with me in writing that you will designate someone at HHS to be the point person that my staff and I can contact to ensure, one, that reforms are being implemented, and two, that we continue to collaborate on reforming the IHS?
Absolutely, Senator. This is an area that is of significant concern because it appears to me, as I know you shared with me, that in the Indian Health Service there are so many areas where we're not meeting the goal of the highest quality care to be provided to individuals accessing that system. And so we're not doing what we ought to do in that system, and I'm committed to making certain, should I be confirmed, to turning that system around.
And as I shared with you, Senator Brasso and I introduced a bill last year called the IHS Accountability Act, which we believe will bring about a lot of structural changes within the IHS. And as I've said many times, that act, although we think it addresses a lot of the problems that have cropped up and is based upon consultation that we received from the tribes, really is merely a first step in the process that's necessary to improve that agency. If confirmed, what types of reforms could you see yourself supporting when it comes to the IHS? And obviously, starting perhaps with our legislation, I don't know, you probably haven't had a chance to look carefully at that yet, but I won't ask you to comment specifically to it, but are there thoughts that you have with respect to the IHS that when it comes to reforms that you could work with us on?
Yeah, I appreciate that. I've had the privilege of visiting some IHS facilities in the state of Wisconsin and a couple facilities that were doing remarkable work. And it appears to me that what we haven't done, and I look forward to getting, if I'm confirmed, getting into this area within the department itself, that what we haven't done is identified best practices within the IHS system itself and shared those and incentivized the ability to move that kind of activity that is providing high-quality care for individuals in that system in certain areas, and making certain that we're able to extend that across the country in the IHS.
Okay. Well, we look forward to working with you on that. I think best practices is a good place to start, and obviously those have not been employed in a lot of facilities in our state. In 2009, CMS issued a final rule that required all outpatient therapeutic services to be provided under direct supervision. Every year since then, the rule has been delayed, either administratively or legislatively, for critical access in small and rural hospitals. And I've shared with you this as well. In my state, obviously, we have a lot of critical access hospitals, a lot of very rural areas, big geography to cover, and sometimes difficult to get providers out to these areas. So the question is, if confirmed, will you work to permanently extend the non-enforcement of this regulation in these hospitals in order to remove this regulatory burden?
Yeah, I look forward to working with you on it, Senator. I think there are areas from a technological standpoint that we are missing the boat, especially in our rural areas in the critical access hospitals. There's in every other industry out there, the information technology age has arrived and is moving across the land with rapid speed and has done so. However, it seems that in healthcare we put roadblocks up to the expansion of technology, especially into the rural areas. And we ought to be incentivizing that so that, again, the patients are able to receive the highest quality care. It's possible now, for example, in our state, if you're an individual who's suspected of having a stroke, you go to a critical access hospital in a rural area. It's possible by telemedicine to be able to access one of the world's foremost specialists in stroke treatment by telemedicine at the University Health Center. So that's improving the lives and care of patients across our state, and I think there's so many things that we could do that would mirror that kind of technological expansion.
Thank you. One final point I'll make, because my time's expiring, but I know you've probably been questioned already a good amount about what happens next with respect to replacing Obamacare. I would simply say that I hope that we can work with you in beginning to shift a lot of the, giving the states, I guess I would say, more flexibility when it comes to designing plans that work in our states. I think one of the problems that we've had with this is there's just too much dictation from Washington, D.C. and too much one-size-fits-all. And that's something I think that most states would probably agree with, and certainly I think most providers would agree with as well. So we look forward to working with you and designing programs that get that flexibility to our states and put them more in charge of some of these issues in a way that removes that power from Washington, D.C., where I think too many of the problems have been happening. Thank you, Mr.